You know, sometimes you're looking at your pet's food bowl, or maybe you find something fuzzy in the back of the fridge,
Hmm.
and you just get that little thought, like, is this just gross, or could it actually be dangerous?
Yeah, that's a common worry. And it's a valid one.
Well, that's exactly what we're digging into today. We're doing a deep dive into mycotoxins, specifically two types that affect dogs and cats, deoxynivalenol, sometimes called vomitoxin,
Okay.
and then these tremorgenic ones, penetrim A and roquefort.
Exactly. Mycotoxins are basically, well, toxins made by fungi, molds,
Stuff we see everywhere.
pretty much. And they can pop up in places you wouldn't always expect, like pet food or that forgotten cheese.
Yeah.
So our goal today is really to equip you, the listener, with the key info on these toxins.
So, what to look for, how pets get exposed, and crucially, what to do about it.
Precisely. Knowledge is power here.
Okay, let's start with deoxynivalenol. Dian, vomitoxin. Didoxin doesn't sound pleasant. What is it exactly? Where's it coming from?
Well, the name gives it away a bit. It's a toxin known for causing vomiting. It's produced by fusarium fungi,
Fusarium.
and these fungi love grains. Think wheat, oats, barley, corn, common stuff.
Which end up in pet food.
Exactly. So for dogs and cats, the main way they encounter Dawn is through contaminated pet food. If those grains used to make the food are moldy.
The toxin gets in the final product. Wow, that's, yeah, a bit concerning.
It is. It starts right back at the ingredient source.
So how does it actually make them sick? What's going on inside?
It's complex, and research is ongoing, but we have a pretty good idea. Dawn seems to mess with basic cell functions. It's thought to inhibit protein synthesis.
So stopping cells from making proteins.
Right. Proteins do everything in the cell, basically, so you throw a wrench in that process.
Things go wrong.
Yeah, cells don't work properly. There's another angle of the immune system. Dawn might actually ramp up certain inflammatory signals, molecules like IL-6.
Ah, so that could make them feel generally unwell and maybe explain why they stop eating.
That's the thinking. It contributes to that sickness behavior, that feed refusal.
Yeah.
And there's also evidence it might directly hit the vomiting center in the brain.
Which would explain the vomiting itself.
And possibly why it can happen so quickly.
Vomiting and refusing food. The name definitely fits. Are some pets more likely to get sick than others, like age or breed?
Well, both dogs and cats are definitely susceptible. Some studies hint that younger animals might show signs more readily.
Okay.
But what's really interesting, the difference between species. Sensitivity varies a lot. Pigs are actually the most sensitive.
Pigs, really?
Yeah, then rodents, then dogs, cats, poultry, humans, and ruminants, like cows, are the least sensitive.
Huh. So dogs and cats are sort of in the middle range?
Kinda, yeah.
Yeah.
It shows how differently species handle these things metabolically. That's why setting safety levels is so complex.
Right. But focusing on our pets, what are the absolute key signs a pet owner should watch for?
The big ones are sudden anorexia, just completely off their food and vomiting.
Sudden is the key word there.
Often, yes. It can come on really fast sometimes, like within minutes of eating the contaminated food.
Wow.
And because they're not eating, maybe vomiting too, you might see weight loss if it goes on for a bit.
Okay. But you mentioned it can resolve quickly, too.
That's the slightly better news.
Yeah.
If you identify and remove the contaminated food source, the signs often clear up pretty quickly as well.
That rapid onset and resolution, that seems like a really important clue for vets.
It definitely is.
So how much Dawn in the food does it take to cause problems? Are there specific levels?
That's a critical question. We have some good experimental data. For dogs, specifically beagles and Brittany Spaniels in these studies, food intake dropped noticeably when Dawn levels got above about 4.5 milligrams per kilogram of food. They're like 4.5 parts per million.
Okay, 4.5 ppm for dogs. What about cats?
For cats, the threshold seemed a bit higher in those studies, more like 7.7 ppm.
So cats might tolerate a little more.
Seems that way for just the food refusal. But when levels got above 8 ppm,
Then you saw vomiting.
yeah, vomiting became pretty common in both dogs and cats at levels over 8 ppm. So even what sounds like small amounts can have a real effect.
Okay, so let's say your pet suddenly stops eating, starts vomiting. How does a vet figure out if it's Dawn versus, well, all the other things that cause vomiting?
Right, that's the challenge. Diagnosis involves ruling things out. A vet's going to consider a lot of possibilities.
Like what?
Well, infections, viral, bacterial, parasites. Other toxins are a big one, like certain insecticides, antifreeze, even poisonous plants.
Like lilies for cats, causing kidney issues?
Exactly, that's a classic example. And then there are underlying medical problems, pancreatitis, GI inflammation, maybe even cancer, all can cause similar signs.
So how do they narrow it down?
Standard tests like blood work and urinalysis are usually the first step. They don't specifically point to DON, but they give a picture of overall health organ function.
Help rule out kidney problems, liver issues, things like that.
Precisely. They help narrow the field. Imaging, like X-rays or ultrasound, might also be done to look for blockages or other internal issues.
But the definitive test.
The definitive diagnosis comes from testing the actual pet food for DON.
Ah, testing the food itself.
Yes. Using lab techniques like chromatography, thin layer, or high-pressure liquid chromatography,
Yeah.
that can actually identify and measure the toxin.
Okay. So if DON is confirmed in the food, what's the treatment? Is there an antidote?
Unfortunately, no specific antidote. But the good news is the main treatment is usually pretty simple. Stop feeding the contaminated food.
Just remove the source.
Exactly. And like we said, that often leads to a really quick turnaround. Vomiting stops, appetite comes back.
What about more severe cases, if they vomited a lot?
Yeah, in those cases, supportive care is key. We'd monitor for dehydration, maybe give fluids to correct electrolyte imbalances if needed, and just make sure they get back to a healthy weight.
But the overall outlook is good.
Generally, yes. The prognosis is typically excellent once that contaminated food is gone.
That's really good to hear. So prevention, how do we avoid this?
It mostly comes down to feeding high-quality food from reputable companies.
Stick with trusted brands.
Pretty much. And proper storage is important too. Keep it dry, sealed, prevent mold growth after you buy it.
Makes sense. Okay, let's shift gears then. You mentioned tremorgenic toxins, penetrim A and roquefortine, the name alone.
Yeah, tremorgenic causing tremors. It sounds and is quite alarming.
So what are these exactly and where do they come from?
Okay, so penetrim A. It's made by a fungus called Penicillium crustosum. Maybe some related species too.
Penicillium, like penicillin.
Related family, yes.
Yeah.
This one, P. crustosum, we see associated with poisonings in dogs that ate moldy bread, cheese, even things like English walnuts.
Moldy pantry items, basically?
Often, yes. Then there's roquefortine, that's produced by Penthapillium roquefortii, again, maybe others. Think Roquefort cheese.
Ah, the blue cheese mold?
That's the one. But the toxin can cause problems. Poisonings linked to roquefortine have happened in dogs that ate moldy cheese, but also decaying organic stuff, like out of a compost pile.
Oh, wow. Compost bins, too.
Yeah. So it's about molds growing on spoiled food or decaying matter. And while it's mainly dogs we worry about here, there have been rare cases reported in cats.
So, again, sneaky molds. Is it mostly about opportunity, dogs getting into stuff they shouldn't, or are some more susceptible?
It seems to be primarily opportunity. Dogs being curious, scavenging. We haven't seen strong evidence that certain breeds or ages are inherently more at risk beyond just behavior patterns. If they eat the moldy stuff, they're at risk.
Okay. And if they do eat it, what are the signs? Those tremors sound scary.
They are. The hallmark signs are moderate to severe muscle tremors and even seizures.
How quickly does that happen?
It can be quite fast, sometimes within minutes, but often within, say, 2 to 4 hours after they eat the contaminated item. That's what reported cases often suggest.
2 to 4 hours. Okay.
And affected dogs can become really hyper-responsive, jumpy, overreacting to sounds or touch.
Any earlier signs before the full-on tremors?
Yes, sometimes. You might see panting, hyperactivity, maybe vomiting initially, wobbliness or poor coordination, ataxia, weakness, a fast heart rate, or just muscle stiffness, rigidity.
A whole range of things leading up to the tremor.
Exactly. And if those tremors or seizures go on for a while, it can cause major problems, like dangerous overheating hyperthermia.
Because of all the muscle activity.
Right. Also low blood sugar, dehydration, and they usually won't eat. Severe cases can be fatal. And high doses in lab studies have caused liver damage, too.
Yikes. That sounds incredibly serious. How much does it take?
It doesn't seem to take much.
Uh-huh.
Experimental data for penetrim A showed that just 0.125 milligrams per kilogram of body weight caused tremors in about 30 minutes.
That sounds tiny.
It is. And a slightly higher dose, 0.5 milligrams, led to severe tremors, liver failure, and death in those experiments. So these are potent toxins.
Definitely. So with signs like seizures, which can have so many causes, how do vets pinpoint these tremorgenic toxins?
Yeah, that differential diagnosis is key again. They have to rule out other toxic causes first.
Like what? Strychnine, insecticides.
Exactly. Strychnine, some insecticides, metaldehyde in snail bait, zinc phosphide or bromethylene in rodent poisons, even things like large amounts of chocolate, caffeine, certain drugs.
Illicit drugs, you mean?
Yes, or even some human medications. And non-toxic causes too, like brain inflammation, congenital problems, metabolic issues like liver or kidney disease affecting the brain.
So blood work and urinalysis again to check organ function.
Yes, those standard tests help assess the patient's status and rule out some of those other metabolic causes. But the most direct way to confirm these specific toxins.
Let me guess, test what they ate or what's in their stomach.
You got it. Analyzing the vomitus or stomach contents collected via gastric lavage, washing out the stomach. Looking for penetrum A or Roquefortine using chromatography again.
Same techniques as for Don.
Essentially, yes. Interestingly, finding a related compound, Rho14C, can be a strong hint that penetrum A is involved. Analyzing bile might also give clues.
Is there anything specific they see in the body itself, like during an autopsy if the worst happens?
Generally, no. There aren't specific telltale signs in the tissues, grossly or microscopically, that scream tremorgenic mycotoxin. Though, as I mentioned, high experimental doses of penetrum A can cause liver damage.
So it really relies on the history. Did the dog get into the trash or compost? And testing the stomach contents if possible.
That's often crucial information, yes.
Okay, so if these toxins are the suspected cause, what's the immediate treatment?
First things first. Stop any more toxin getting in. Remove the moldy foods, secure the compost bin, whatever the source is.
Decontamination.
Absolutely. If it's safe and happened recently, inducing vomiting is usually step one. Or gastric lavage, washing the stomach, followed by activated charcoal.
To bind up any remaining toxin.
Exactly. Then it's managing the signs. Controlling body temperature is vital if they're hyperthermic from tremors or seizures.
Medications for the seizures and tremors.
Definitely. Diazepam, often given IV, is usually the first choice for seizures. If that's not enough, we might use barbiturates like phenobarbital. For the muscle tremors themselves, a muscle relaxant called methocarbamol can be really helpful.
And other supportive care. Fluids.
Yes, 5E fluids are often needed for hydration, electrolyte balance, and sometimes sodium bicarbonate if their blood chemistry is off due to the seizures or muscle damage.
What about follow-up? What needs monitoring during recovery?
Continued close monitoring is essential. Watching for any return of tremors or seizures, checking temperature, hydration, acid-base balance. We also need to monitor for potential complications, like liver damage or muscle breakdown rhabdomyolysis, which can hurt the kidneys. And breathing difficulties, maybe from aspiration pneumonia if they vomited heavily or during lavage.
So potential complications are serious. Uncontrolled seizures, liver damage.
Right. Acid-base problems, rhabdo, aspiration pneumonia. And as we said, sometimes, sadly, the exposure can be fatal despite treatment.
It sounds terrifying. But what's the general prognosis if they do get prompt treatment?
If treatment is started quickly, decontamination is effective, and the seizures are controlled, the prognosis is actually very good.
Oh, good.
Most dogs recover fully, often within 24 to 48 hours.
That quickly?
Often, yes, though some might have some lingering effects for a bit longer, maybe some weakness, stiffness, or slight incoordination that clears up over a week or two.
But most make a full recovery.
The vast majority, yes, with prompt, aggressive care. But prevention is obviously much better.
And prevention sounds like keep your dog away from moldy stuff.
That's the bottom line. Secure your garbage cans, keep compost bins inaccessible, be careful with leftovers, especially bread and cheese that can get moldy easily. Don't let them scavenge.
Vigilance is key, especially if you have a dog who likes to explore with their mouth.
Exactly. I mean, you can just picture the panic, right? Seeing your dog suddenly start shaking uncontrollably after getting into something.
Definitely want to avoid that. Okay, so let's just quickly recap the key points from this deep dive.
That's good.
We covered two main types of mycotoxins. First, dioxinovillanol, Dogen, or vomitoxin. Found in grains, gets into pet food. Main signs: sudden vomiting, loss of appetite. Quick onset, often quick resolution if the food is removed.
Right. Diagnosed ideally by testing the food. Treatment is removing the source, plus supportive care if needed. Prognosis generally excellent.
Then the tremorgenic toxins, penetrum A and Roquefortine, found in moldy food items, bread, cheese, walnuts, and compost.
Correct. Causing those scary muscle tremors and seizures, often starting within a few hours. Also hyperresponsiveness, maybe vomiting, weakness earlier on.
Diagnosis involves ruling out many other causes, checking stomach contents if possible. Treatment is urgent: decontamination, seizure control with drugs like diazepam, tremor control with methocarbamol, intensive supportive care.
And the prognosis there is very good with prompt treatment, though potentially fatal if severe or untreated. Prevention is all about stopping access to moldy materials.
So the big takeaways seem to be: Be aware these things exist, know the different signs to look for, and if you suspect either type of mycotoxin exposure.
Act fast, remove the suspected source immediately, and get to a veterinarian right away. Time is critical.
Absolutely.
So maybe next time you're dealing with your pet's food or you see that bit of mold somewhere, just take a second. Think about that hidden world of fungi and the powerful compounds they can make.
A good reminder about food safety for us and our pets, and just being aware of what's in their environment.
Exactly. Vomitoxin, tremorgenic toxins, different threats, but the same core message. Invisible molds can pose real dangers. It really highlights why being mindful about food quality and preventing scavenging is so important.
Makes you look at that slightly fuzzy bit of cheese a little differently, doesn't it?
It certainly does. A little bit of caution goes a long way.